Hey there, welcome back to my channel. My name's Erica. I am a final semester nursing student and I wanted to make a video today on what's in my book bag. So I usually use the same book bag or backpack for clinical and for school, for lecture and lab. And it's this backpack here. It's just a Columbia backpack. I can't remember where I got it from, but it's from one of those sports stores, and it has really good shoulder support. It has two cup holders on the side, and it has two pockets. One's a big pocket with like a flap in there for you to put your laptop, and then the other one is a smaller pocket, and then there's a little teeny tiny pocket right here in the front where I usually put my keys or like things I want to be able to easily access, like my ID for one. So anyways, I wanted to make a video today on what's in my bag, and I'll kind of tell you what I usually take out when I go to clinical, and usually all of this is in here when I go to lecture, but I take out a few things when I go to clinical. So let's get started. For one, I always have my iPad with me. I have this case on it, and I have it right here. So whenever I open it up, it's usually locked, of course. I have a picture of my two babies on here, and then I have my own little like square thing for where I put all my school stuff, and that's right here. So I have like Google Drive, I have slides because sometimes we do group projects where we have to share a PowerPoint and we do a PowerPoint presentation. And then I have my Canvas app. Let's see if you can see it. I have my Canvas app, Quizlet. I have NCLEX RN, even though I don't use it. I've never like subscribed for it or anything, but I was thinking about it. I have my bookshelf app, which is where my textbooks are because my school does ebooks. I have files, and that basically links my files from my laptop to my iPad. I have PowerPoint there, Word, Docs, Notability, which I use a lot, and then UWorld. So UWorld is a subscription that you can purchase that gives you a bank of questions that helps prepare you for the NCLEX. I purchased mine in, I want to say April or so, and it helped me study throughout my third block. So I studied my OB portion and my med-surg portion with UWorld, and I found it really, really helpful. It's super convenient. It's an app, like I said, you can use it on your iPad, on your iPhone, or whatever electronic device. I believe it works on basically anything. It's just an app subscription. You can also use it on your computer if you want to. I mostly use it either on my iPad or on my iPhone. And it's really, I don't know, it's really convenient. I recommend it. I like it. It is an extra cost, and you can look on the website to see what it costs, but if you're able to get it, I definitely recommend getting it. And then, so just a little bit to like show what my Canvas app is. It basically has my two different schools, ASU and MCC. And I can just access my classes really easily. I can click on it right here, and I have all my material here. I guess you can't really see. Let me see if I turn it. I guess you can see it a little bit better. It'll probably be backwards, but I'm able to access all the content that is put onto the website for my class through my iPad, and it's super convenient. I love just having this little teeny tiny iPad to access everything. I usually import my PowerPoints from my class Canvas app onto the Notability app, and it's where I end up taking all of my notes. So for example, I'm going to go back in and I'm going to show you like how I organized last block, which was OB and med-surg, but we'll just go over OB. So OB I have right here, and you see I have it color coordinated right there by OB exam 1, and I have all of my PowerPoints right there. And I took notes on these during our lecture and during the voiceover lectures that our instructor did for us. It's super helpful. I do that with my Apple Pencil right here. Anyways, super helpful. I definitely recommend also purchasing an iPad Pro if you're able to. I really love it. I love using the Notability app. I don't use the binder at all. I do carry some paper material just in case I need it, because obviously the whole world is not electronic, so it's necessary for me to have paper material still when I need it. So definitely recommend it. If you want a tutorial on how I organize my iPad, I'll definitely show you. I think I already made a video on, well, I don't think I made a video already on how I take notes. I usually take them onto the PowerPoint, but I showed on my video that you can take them like through a paper version of the app. Again, I usually use the PowerPoint. I love using it, and I do a recording feature. It's super cool. So if you want a video on how I organize my iPad with all my PowerPoints, it's basically like my binder, but it's electronic, and I love it because I don't have to worry about my paper getting crumpled, ripped, written on, drink spilled on. I mean, God forbid I ever spill anything on here, but you know what I mean. Also, I'm really red right here because anytime I like scratch myself, I turn really red really quickly. So ignore that. So yeah, I always take my iPad with me. I use it in every class, in lecture, lab, whenever I need it. And for studying, I do not leave the house without my iPad. I don't take my laptop that much to school, only if I think I'm gonna need it, but I usually don't ever need it. I also have a notebook in here. Like I said, the whole world is not electronic, so I bring a notebook just in case I need to use one for whatever reason. I have my planner in here, which basically has everything in here that I need to know about the semester. I have my orientation for Block 4 this Friday. I'm super excited, but I'm also nervous at the same time. I'm not ready for summer to end, but I'm definitely ready for nursing school to end. So once I go through my orientation, I'll be able to write a little bit more into my planner. I haven't written that much in here except for like my clinical dates, my capstone dates, and a capstone is basically the area that I chose to do an additional clinical in that I would be interested in specializing. And for my capstone, I chose OB. So let me just show you a little bit. So right here is my planner. It'll probably be backwards, but so right here, I don't know why it's erased, but I have right here, I have my, what am I trying to say? So we're doing our skills check off. We did this in Block 3, but because we're going into our 4th semester, we basically need to prove that we know how to still do this. Also on here is I have like my Block 4 orientation. Like I said, I have it this Friday, and then I have a pharmacology lab for pediatrics. And then I have like my clinical dates on here. And then I have like my lecture and my lab days. And then another thing that I haven't wrote in here is my simulations. In Block 4, we're assigned simulations, or we sign up for simulations, and they're offered like on 2 or 3 different days. So I don't know which day I'm going yet because I haven't been able to sign up for them yet. But hopefully in our orientation, we'll be told how, when, what, and how we're able to sign up for our simulations so that I can write them into my planner and I know when I'm going to simulation, so I'm not confused on when I'm going to be at school. Anyway, so yeah, I have my planner. Always make sure I have it. I also wrote in my like exam dates, quiz dates, and all of that. This is my clipboard. I take this both to clinical and to lecture and lab, because if I need it write on a clipboard with like a paper, it's helpful rather than trying to write on something and like ripping a hole in my paper or something. In here I have my skills checkoff list, and it's basically a list that we're given at the very beginning of Block 1, and we're supposed to write in the skills that we've performed throughout our nursing school career or semesters, whatever. And you're supposed to like write in the date that you performed the skill, and there's like 12 pages of skills that we are supposed to be doing. A lot of them are basic that you wouldn't even think to write in, like say nail care, hair care that we're assisting our patients with. But by the end of this block, we're supposed to turn this in, and I believe all of them should be checked off. The clipboard also has this little notebook here if I need to use it. Sometimes I do use them in clinical if I need to jot something down that my nurse needs me to jot down. I also have a brain sheet here, and I got this from one of my one of the nurses I followed last clinical in block 3, and I thought it was really cool, so I asked her if she can make me copies. She made me copies, and now I have it. I thought it was really cool because it has everything I need to know for the whole day for a patient that I'm taking care of. And anyways, I really like it. It has like who the doctors are, the name of the patient, the date of birth, the room, if there's any allergies, a diet, if they're a code or not. It has lab values that we might need to know, their admit date, diagnosis, what their plan is. So obviously when you go into care for a patient, there's some type of nursing plan, and it's nice to have it like written down here. There's also a section for pain meds, which I thought was super cool because you want to make sure you're staying on top of your patient's pain. There's like bowel movement information here, if they have a Foley or not. And then there's a time schedule here from 8 till 6, and I thought that's really cool because you can write in your medications. The nurse that I followed, she would write in her medications, and she would put like when they're due. And I thought this is really helpful because if you have a patient who needs, say, every few hours like a glucose check, or if they have some type of medication that they get every so often, then you can write it in here and you can look at it on your clipboard so that you don't forget. It also has where they have IV access, if they're running any fluids, if they're diabetic, and when you'll do their glucose checks. And then also things like if they have a Lovenox or a heparin drip, how often you're rounding on them, and then you can like mark it off, which I thought was super cool. It has the Braden scale, the fall risk, the Glasgow scale. It has like who the CNA that's helping you, who gave you a report. Anyways, it's super, super cool. I really like this brain sheet. If I could upload it in some way and like give it to anybody who's interested in it, let me know. I'll definitely try my best to do that. I don't know how I would, but I'll try if you're interested in it. So that's my clipboard. I always make sure that's also at clinical. So far, like I've gone through my planner, the notebook, my iPad, and the clipboard. The only thing so far that I've gone through that I take to clinical is my clipboard. Another thing I take to school is just a folder. I take this just in case I get any handouts. I don't, like I said, most of my handouts I import from the Canvas app onto my iPad, so I don't usually need any handouts, but sometimes I get them anyways because they give them out. But for example, what I have in here that I took to clinical last semester in my OB clinical was this big old packet. I don't even know how many pages it is, but it's really, really long. It's really thick, as you can see. And we were given this packet that we had to work on before we started clinicals. So there's the different units that you can go to in OB, and it's separated here on the packet, and we had to make sure that we finished that part of the packet before we walked onto the clinical floor. And I thought that was so cool because it made sure that when you're going into clinical, you at least know something about what you are going to see. And I don't know, I thought it was really cool, and it kind of prepares you. And I would take it to clinical with me, obviously, because I'd have to show my instructor that I did it. She would grade it or add any notes if I forgot anything, and then she would give it back to me. And then if I had any downtime, I would look at it and kind of study it, because this is the same information that we're getting quizzed on during exams. Also all messed up in here, and an example why I love my iPad is because look how crinkled this paper is. I'm not very good at making sure they don't get crinkled, but this is like my block 4 like overview of the hours that we're going to be at school, important dates, and so on and so forth. So I always make sure to have a folder with me to make sure I can put any handouts in here. and I just actually emptied it because it was full of handouts from last semester, and I did not empty it or go through it at all during the summer. I just put it in a random like manila folder, and I put it in this little file box that I have, because if I need to look at it when I start prepping for the NCLEX, I can go back and look at it. Another thing I have here is it's a little bag. I got this from Ipsy, I think, when I had the subscription. I don't have it anymore. But I just have like a clicker pen. These are really helpful for clinical so that you don't lose the caps. So I always make sure to take that. I have this pen, which is just like a cute Harry Potter pen. It's the Elder Wand for any Harry Potter nerds out there like myself. And then I have just a pencil I take for lecture if I need it, and then I have a Sharpie. This is helpful if you need it for clinical too. So there's that. And then I have in my next pocket, those are most of my like bigger things. So in my smaller pocket, I have these note cards. I usually don't use them in lecture or anything, but sometimes, one time I finished up a little spiral notebook that I used in clinical, and I had these at home, so I decided to take these to clinical, and I started using these to write little notes on that I needed to write for a patient if I needed them. Like if I needed to jot something down. I also use them to like quiz myself, to like jot something down if I'm at clinical and I want to like quiz myself and like write out by memory what I know and like look back at it later. So there's that. I have this, which is like a toiletry bag. It's important to have that, especially, well, when you go anywhere, but especially if you're at clinical, because it's not so easy to like say, hey, oh my gosh, I just started my period, I need to go buy a tampon or buy whatever. So I have a mascara in here. I have toothpaste in here, and this is just like if I ate something and I feel like my breath smells after lunch in clinical, then I don't take a toothbrush or anything because it's a little bit too intense for me. I just use that and I'll like brush my teeth with my finger or something in the bathroom. I have flossers in here that I do use after lunch because food always gets stuck in my teeth. I have alcohol swabs. I usually use these like for my phone to clean it because we're always touching our phone. I have panty liners, which I don't normally use, but I have them in here just in case. I have a tampon. I usually have a chapstick in here too. I don't know where it's at, but I usually have a chapstick. And then I have my stethoscope, which you've got to make sure you have for clinical and for lab. Mine is a Littman Classic 3. So it's this pretty like purple maroonish color. Sometimes it looks red, sometimes it looks hot pink, but it's like a purple maroonish color. I really like it, and it has like this smoke gunmetal color. It's really, really pretty. It works really well too, so. I also have a charger in here, and that's if like my phone's dying for whatever reason in clinical or in lab, lecture. I have trauma scissors. I got these off of Amazon. It has this little thing so you can clip it to your pants or scrubs, whatever. I usually just carry it in my pocket. I usually would have a pen light in here too, but I don't know where it's at. I need to look for it because clinical's are ready for me to start next week. So I also have highlighters here in these pockets. My watch, you can really get any watch as long as it has a second hand so that you can take pulses and respiration. So you always want to make sure to have your watch. I also have an Apple Watch, but one time when I was leaving for clinical, I think it was in block 2, it was in my scrub pocket, and I pulled out my keys, which were in the same pocket, and they were like entwined with each other, and I pulled it out and boom, it landed right on the face and cracked. So don't do that. Here's my chapstick. Your lips get so dry in clinical, so I definitely recommend always having a chapstick with you. I always have one with me everywhere I go, but definitely make sure you have one, at least for clinical. I have my badge in here. and you need this for clinical or else you cannot enter a unit. I have this little water thing. It's like those vitamin water things that you pour into your water bottle. I have that just in case I want to drink something other than water. You also want to make sure you take water to clinical, plenty of water, because it's so easy to become dehydrated. It's very easy to neglect drinking water or going to the bathroom while you're at clinical, so definitely make sure that you take water. But yeah, that's basically all I take to clinical and to lecture. For clinical, I take out my notebook, my planner, and my iPad, but I do take my folder and my clipboard, and I'll take like my watch, my stethoscope, of course, a charger, my toiletry bag, my pencil bag, and I also take my pen light whenever I have it, my trauma scissors, a wallet, cash, if I need cash. So yeah, that's what I take. If you want to see a video on like how I organize my Notability app so that it's like a electronic binder, let me know, I can make that. Or if you have any questions or any suggestions on videos that I should make, please let me know. I'm looking for suggestions on videos that people would be interested in watching, because I have an idea of what I would want to watch, but it's probably not the same, or maybe it's the same that other people would want to watch. So definitely let me know, and leave a comment if you have any questions, like the video if you found it helpful, and thanks for watching my video.